Hi, I'm Tracey Mancuso, and this is Maya Hart. She's our clinical specialist.
Hi, Tracey.
So Maya, our viewers are actually writing into us, and they have some questions. Would you be able to answer them for me?
Absolutely.
Wonderful. The first one, do I need to use different treatment protocols for Fitzpatrick types 4 and 5?
Well, actually, Tracey, the NP² technology is colorblind, so you can treat any type of skin, including Fitzpatrick type 4 and 5.
Fantastic. How many treatments for the face and body do you recommend?
We generally recommend 6 to 8 treatments for the face and about 8 to 10 treatments for the body.
Wonderful. How many areas are we able to treat in one sitting?
There's actually no limitation as long as the patient has the time and the patience. You can go ahead and treat the entire body, face, neck, arms, buttocks, thighs, whatever they want.
What a great question. Can this treatment help with loose skin?
Absolutely, Tracey. As a matter of fact, the NP² technology increases production of collagen and elastic fibers. Now, the lack of collagen and elastic fibers, among other factors, are what causes loose skin. So we're definitely addressing this problem, and you will definitely see a great improvement in the appearance of loose skin.
Great. How long will the results last? This is a really good question.
Well, Tracey, results are very individual, and it is very difficult to anticipate how a certain patient will react. However, from our extensive experience, we can say that a lot of our patients actually see continuously improving results even at 6 months after the completion of a series of treatments. And of course, we do recommend, however, to maintain the initial results, to perform maintenance treatments every 2 to 3 months.
That's fantastic. So Maya, does everyone require 6 to 8 treatments for face and 8 to 10 treatments for body?
Well, this number is applicable to the majority of clients. However, it is important to remember that some clients may require less or more treatments.
Okay. If you go above 41 degrees Celsius and 39 degrees Celsius, can you cause harm to the patient?
Well, Tracey, 39 degrees or 41 are the minimum therapeutic temperature in order to get good results. 39 is applicable for face and neck treatments, and 41 degrees for the rest of the body. It is important to remember that you can, and we even encourage you to reach even higher temperature as long as the client still feels comfortable and can tolerate it, and this will give you even better results. It is perfectly safe. Great,
that was an excellent question. Can you treat longer than recommended treatments if someone has a lot of fat on the body? We get this question a lot.
Tracey, yes, you may. You may increase it, once again, depending on the size and the severity of the problem. Of course, someone with a larger figure or with a substantial amount of fat, for example, or wrinkles, may require a longer treatment time.
Wonderful. When do patients start to see results?
Tracey, there are 2 types of results. You've got the immediate results. These results are due to the contraction of collagen fibers in the skin. Now, these results, they don't last very long, but they do give you the wow effect. And of course, then again, you have the long-term results, which will start appearing starting from the 4th treatment or so.
Can you treat more than 1 week apart? And what is the maximum of time between treatments?
Our recommendation is to treat once a week. However, we're all human beings, and if we skip a treatment, if it happens once or even twice, it's okay. You can just continue with the series of treatments uninterrupted, and you'll still get the good results. But once again, our protocol calls for weekly treatments.
Great. What is the maximum amount of treatments that someone can have in 1 week?
We recommend having no more than 2 treatments per week. Now, the reason we recommend this is because we want to allow the body time to heal. We're actually triggering a healing process of the skin. If we did a treatment every day, we would not allow the body the time that it takes to actually for these processes to take place. So this is why we recommend a weekly treatment.
Wonderful. What BMI should stop treating for cellulite and circumferential reduction?
Well, Tracey, I can say that optimal results will be achieved with patients of BMI of 30 or less.
Okay, wonderful, thanks. Could you treat above the breast tissue for a lifting effect?
Yes, you
What
may.
a great question.
Yes, you may. You can treat the décolleté area for a lift-in effect. Just make sure not to treat directly over the breast area.
Great. If the person is larger or smaller, can I increase or decrease the treatment times?
If the person is larger, then you may increase the treatment time. However, it is not recommended to decrease the treatment time, even if you have a client with a very small figure. What you can do is either decrease the energy level, or, for example, if you're treating the muffin tops, you can use the diamond polar applicator, which is of smaller size.
Great. Can you treat somebody with the octopolar handpiece if they have larger arms instead of the diamond polar? And if so, will the machine allow you to do so?
Yes. The answer is yes and yes. You may. You may use the octopolar instead of the diamond polar, and the machine will allow you to do it. You just need to adjust the parameters accordingly.
Great. How should I clean the applicators before and after the treatment? I get this question all the time.
Well, Tracy, you clean the plastic parts, the plastic and the rubber parts of the applicator simply with baby wipes. The part of the applicator that comes in contact with the skin, the electrodes, you can clean it, and it is recommended to clean it with disinfectant wipes.
Wonderful. Thank you very much, Maya. I appreciate you answering all of those questions. Our clinical staff is ready to answer all of your questions during our live webinars that we're going to be holding. So please send us all of your questions. We're here to support you.